I've been trying to teach people to floss since the really early 70s. My dental school class was very fortunate because we were able to hear a dentist lecture in a 2-day lecture named Dr. Bob Barkley from a rural area of Illinois in the spring of actually 1971. And Dr. Barkley's topic was preventive dentistry. And that seems like a fairly dull and boring topic. But Dr. Barkley had a way to make it very exciting. And one of the things that Dr. Barkley did to motivate his patients to floss is he brought them in every day for 5 straight days and made sure that their teeth got flossed correctly in his office. Either the patient did it or the staff assisted the patient. At the end of those 5 days, the patients could see the benefit of flossing, see that their gums were no longer bleeding as much when they flossed, and then that would help them get the habit. Well, that's very difficult to do. And even though Dr. Barkley was successful with it, it's really not realistic. Also, back in the 70s, it was very popular to use a material called disclosing solution, and they still sell it. It's a red dye that you place on your teeth, either tablets or a liquid, and it shows where you missed the flossing. As a matter of fact, in that era, there was a lot of excitement in dentistry about preventive dentistry and particularly about flossing. Well, that era is gone. The excitement now in dentistry among dentists is bleaching, implants, cosmetic dentistry. Everybody's sort of forgotten about flossing. But it's as important as it's very, very important. It's just that we don't emphasize it enough. One of the things I've learned is to not give patients too much information. Now, in other segments, I've talked about unwaxed floss. I want to say a little bit more about that. The floss that my wife and I like to use is made by a company called Butler, and they call it gum floss, and specifically unwaxed fine is the type we like. We'll show that address in just a moment. As a matter of fact, we have to get this on a website because it's not sold in local stores. We pay full retail for it. As a matter of fact, the website shows where we actually get our floss at full retail. But it's not the arrow, it's the indent. If you can use any type of unwaxed floss or any type of floss for that matter and do a good job. But this is just what we like because it's thin, it's easier to get through teeth, and it does a very good job. But just get whatever you can find in the local drugstores to get you started. What about other devices? If you have fixed bridge work, you need something called a floss threader. The best way to learn about that is to have our office or another dental office show you. What about electric toothbrushes? They work great. Sonic toothbrushes work great. I only caution you that it is not the device, it's how you use it. So you still have to use them the correct way. Are any of these devices a substitute for flossing? Absolutely not. They will advertise and insinuate that they are, that they get in between the teeth, etc., etc. Nothing is a substitute for flossing. The most damaging thing that has come on the market lately in the terms of advertising is one of the major mouthwash companies came out with an advertising campaign, and they said that if you use our mouthwash, you don't have to floss. Nothing could be further from the truth. As a matter of fact, the National Periodontal Association made them take those ads off the air, and you notice they no longer advertise that. So if you want to have healthy gums, flossing is essential. What if you just do not have the dexterity to floss? They do make some aids or fork-like devices, and you can put the floss in the fork and get it back between your teeth. Find one of those in a drugstore, bring it in, and we'll show you how to use it. And there are other devices, the little rubber tip on the end of toothbrushes. That's basically useless. They say it's to massage gums. Gums don't need to be massaged. The only thing we need to do with gums is to get the plaque off the teeth near the gums. So the marketplace itself has confused patients. The advertising for mouthwash, the advertising for the mechanical toothbrushes. The main thing is to either use a manual toothbrush or some type of electric toothbrush and do a good job there. but you have to floss. So if you have any questions, give us a call. We'll be happy to answer them, myself, one of the other dentists, one of the hygienists, because we really do want you to have healthy teeth.